Thanks, Jen. That will help our heart health and my attentiveness. Next up, we're going to talk with the mayor about why he treats hypertension prevention and management as a priority in his community and how he translates that to action. Jen Childress is going to interview Errick Simmons, mayor of Greenville in the Mississippi Delta. Mayor Simmons was elected with the largest percentage of the vote, 74%, in the history of Greenville. Jen and Mayor Simmons.
Thank you so much for joining us today, Mayor Simmons. Can you tell us why you've made heart health a priority in the city of Greenville?
Jen, I want to thank you so much for the question. I want to thank all of your viewers for being able to be a part of this very important topic. When you think about Mississippi, Mississippi is the unhealthiest state in the nation, but it's also the poorest state in the nation. And I represent a city that has a 38.6% poverty rate. And when you begin to think about the quality of life, the quantity of life of folks that you represent, you begin to see that heart health is really at the top of the disparities, health disparities that we're seeing with poor folks right here in the Mississippi Delta. And so it's not only a critical point and factor in the platforms and the policies that we put forward, but it is a human dignity, and it is something critical that we have to support and address to build better, sustainable communities, a better Greenville, Mississippi, but overall a better Mississippi Delta and Mississippi as well.
I love that you frame it in that way as being something critical to address and just a human need. So what are some of the ways specifically that you're addressing health equity in Greenville?
It's very important to look at where we are statistically in a state that has, quite frankly, failed to care about its poorest. We have expanded Medicaid in the state of Mississippi. Last year, we had a nurses shortage because of that failure over the last 10 years of 2,200 nurses. This year, as I speak, that nurses shortage has increased to 4,700 nurses. And so when you begin to think about heart health, and when you begin to think about the health disparities that plaguing poor folks in Greenville, we're dying. We got 38 hospitals on the verge of closing down in Mississippi. In my city, Greenville, Mississippi, the only neonatal clinic in the Mississippi Delta at my hospital shut down in June. So when you talk about infant mortality, when you talk about heart disease, when you talk about diabetes, and when you really talk about all of these health conditions, heart disease really is at the heart of it. And so our folks can't afford to have a catastrophic injury because they in fact die. Our communities are dying economically because we hadn't expanded it, but our people are literally dying because of the lack of health outcomes. Hypertension is the biggest risk factor. Heart disease, stroke in the Mississippi Delta. 43.6% of the Mississippi Deltas are diagnosed with hypertension, which accounts for over half of the deaths in this area. Heart disease and stroke were first and fifth leading cause of death in Mississippi. So the causes included in obesity, smoking, poor diet, and inactivity. We have to begin to look at a bottom-up approach. And so what I've done as a mayor is put things on a primary care level. We've done a number of projects, Jen, to try to address not only unhealthy eating and poor diet in those, but to make sure our folks begin to look at nutritious ways so they don't get to the hospital in a medically underserved area. People have no insurance, no money to go to the doctor, no transportation. And the ones that can go to the doctor, for most part, sometimes don't take their meds or do what the doctor is telling them. We're in an area that is broadband challenge as well. And so when we talk about telemedicine and things like that, we need to make sure we funnel broadband. And we want to thank the Biden-Harris administration for thinking about that in an underserved area like the Mississippi Delta to make sure folks are having the things that they need to have telemedicine. But for the most part, you'll see here in the mayor's office, us walking across the street to the library and setting computers up to get our folks in the room to make sure they can get on when they with their doctor when they need to, because some folks really don't have computers at home. Our mayor's health council offers a number of health fairs to the community so they can know their numbers. Knowing is caring. And I always say, knowing is caring. Knowing your numbers is caring for yourself, is caring for your family, and is caring for your community. So we push that platform for our folks to understand. You got to know your numbers. You got to know your diabetes numbers. And we have those terms in the Mississippi Delta. We don't say diabetes, we say sugar. We don't say hypertension, we say blood pressure. And so those are the terms that the folks in my community understand. And that's how they're becoming more healthy and becoming more aware. I'm a firm believer. In order for us to get past um, these disparities, to address poverty, but more importantly, to address the health disparities, to have better outcomes, we got to do three things. We have to educate our people, and we're doing that. We have to engage. And I want to thank you with the National Forum, engage with folks like the African American Mayors Association, American Beverage Foundation, that we just received a grant for 75,000 to work with our food corps, a private industry, Mars Food, that is helping us with a number of things, in $2.5 million, Leno Health with another $1.25 million, and Kroger Foods that is doing about $500,000 to make sure we put down on the bottom level ways to do preventive care, but also other activities to create a more healthier population here in the city of Greenville. I can say that our Mayor's Health Council is on a number of projects. We do 4 events a month with our Mayor's Health Council. And that council has two nurse practitioners to help educate our community. We partner with the YMCA on hypertension programs to offer 4 month of free exercise to our residents, because folks can't pay to go to the Y. Folks can't pay. So we provide that exercise free to our folks for 4 months to get them in the habit of exercising, because it's very important. Diet counseling and weekly blood pressure checking and reading that we do, not only for our employees, but the folks in the community as well. We do a Miles with the and that Miles with the Mayor is on the levee front. You see a scenic view of Lake Mississippi River, but you're able to talk to your mayor about a pothole, a dog a cat in the tree, what's plaguing you with your water bill. But as you're doing it and engaging with your mayor, we're walking, because we're creating an attitude that you can stay engaged, but you can stay fit as well. So we do the Miles with the Mayor on our walking trail. We help in other ways to work to reduce health disparities, improve cardiovascular health with Mississippi Deltans by increasing access to screenings, referrals to partner clinics for treatment, and by adopting policies that increase the access to healthier food options, physical activity, and smoke-free environment. More free programs such as the mobile units that we are moving around to go to different neighborhoods to offer various exams and education on various diseases as well. I want to say our food court program is right there at our elementary schools. We have a food court and food court service member. These are AmeriCorps members that are in every public school. And in Greenville, to show you the level of poverty, all of our public schools has 100% free and reduced lunch. We got folks who go home. Our children go home, and for dinner they eat a honey bun and Roman noodles and a fruit juice to go to bed. So what we're trying to do is say you can eat healthier, you can eat better. But we all know, Jen, if a child is hungry, they can't learn. But more importantly, if their parents are hungry, they can work. So it's a development project. It's a workforce development project. We're doing community gardens in all schools. We're teaching our folks how to grow their own food, but they're also able to get a can of green beans to see the sodium content, or look on the back of a pack of bacon and see what the sodium is, to say, look, I may need to put this to the side because it's going to increase the amount of sodium content. If it does that, it's going to increase the heart disease that we're plagued with. So we're doing a number of projects, but I just want to close by saying it's very important for us to do bottom up action to dispel, but to also address those health disparities. And we're doing it by educating our folks. We're doing it by engaging with a number of folks, like the people in the room today, but private folks, private industry, nonprofits, our healthcare partners, but also we're doing that to educate to engage, but to execute a plan that's going to be inclusive of the community, but it's also going to be a plan that's going to help create a more healthier city population that will ultimately build stronger communities. I'm a firm believer, Jen. If you educate your folks, you engage in and execute, you'll strengthen individuals, you'll build stronger families, create sustainable communities. Thank you for your time.
Thank you so much, Mayor Simmons. That's incredible. And your passion is absolutely evident in everything that you do and how much you truly care about your community members and making a difference in education, engagement, awareness, access. And so what is one piece of advice that you would give to audience members to help them get their own mayors engaged in promoting heart health within their communities?
I would just keep it with the people. We are in the people business. And when I get out my car from City Hall and I walk down Main Street and a resident calls me and says, Mayor, last night my mother went to the hospital and she was ill and she's on a ventilator. Or when I go into Walmart or Kroger and a little child is there saying, Mayor Simmons, thank you for coming to my school and thank you for teaching me about some healthy options that we can have with yogurt. Or when I'm in church and my pastor began to talk about the challenges that our communities are facing. And we get the spiritual food, but before you can get that spiritual food, you got to have the food. It brings my heart joy to know that we're doing the work of people. And I would just encourage all of your folks out there, if you want to get your mayor involved, talk to the people. Because for the most part, we are in the people. And what's best for people is best for the world. I'll close with this story. As I was preparing my remarks tonight to talk about the things that I would say, to talk to all of your audience about heart health disease, about health disparities, I was getting ready to make my remarks and getting ready to develop what I was going to say. And I was really disturbed by my 3-year-old child. And my 3-year-old child came in because she wanted to not only play Coco Melon or do TikTok, she wanted to just play with her daddy. And as she was doing it, I said, you know what I'll do? I will give her a 10,000 piece puzzle of the world. And I know if I give her a 10,000 piece puzzle of the world, it would keep her busy. It would keep her busy and it will keep her busy. And I can go ahead and get these remarks together. In less than 10 minutes, she came back in. And she said, Dad, I'm ready to play. This puzzle is complete. I said, 10,000 pieces? Elin, how did you do it? She said, Daddy, you see, on the other side of the world is a picture of the man. And see, once the man is right, the world is right.
Oh my
And
gosh.
so to your viewers, I would just say, if we can get in the people business, and regardless of the label you carry, regardless of the color of your skin, regardless of the zip code that you have, if you do the business of encouraging and strengthening people, as the Bible tells us, love thy neighbor as thyself. Once the man is right and we do what we need to do to help our fellow man, the world will be right. We could get rid of heart diabetes. We can get rid of heart hypertension, diabetes. We can get rid of all the diseases that we're facing if we truly just take care of the man. The world will be right, and the societal ills we face, we can begin to address collectively together. Thank you so much, Jim.
Oh, thank you so much, Mayor Simmons. It's evident how much you truly care, and thank you for sharing your great work that you're doing with you and your team in the city of Greenville and inspiring others throughout the nation on how they too can make a difference and make an impact one person at a time to really truly be heartfelt and make change. Thank you so much.
Thank you, Jen, and I want to thank everybody listening for the work that they're doing in their communities as well.